Been talking about this, but we're going to walk you through the entire surgery, the entire process of rib repositioning. Remember, this is ideal for people who just want to be a little bit more of an hourglass type figure. You know, we do our liposculpting, our BBLs, we do our hip dip filling, but the idea is that sometimes people are just a little square, sometimes they're very, very thin, and there's not a lot of fat to transform. And so in the old days, rib removal stuff was a very barbaric surgical procedure because it took a lot of incisions. It took, removing the actual rib stuff. This is just transforming you just a little bit to make that great difference. I'm going to show you what we did, and this is super cool because this is game changing. And so here was the actual CT scan done where the initial study showed this, because if you look at this, you can see where the rib is right here. And so you see that distance is just very, very small as we come in, right? The idea is that we're going to move these ribs in just to make that overall space more narrow in terms of the waist. So here's the post-op CT scan that makes that difference so much better in terms of moving this in. It's just the two free-floating ribs that come here and here. So the idea is you're moving that waist in on both sides. When we show you an actual patient, so here's a skinny BBL, right? Just a little square, got a little love handles here, so we were able to liposculpt her and get her to a spot where she's got that nice kind of sweetheart. But let's say you wanted a little bit more of a figure. If you think about it, if you can get some of these ribs that are coming here to just go in a little bit, now you've got a little bit more of this figure here on each side. And I can even change colors here just to get you a different idea in terms of this a little bit. But you could see that if you come in this way, how much more that figure just accentuates and you get that nice sweetheart shape. So for our super skinny BBLs, for people that have had a tummy tuck, had a BBL in the past, so you can either do this with our skinny BBLs at the exact same time of the liposculpting, or if you've already had a procedure, don't worry, it's not too late. We can still come back, we can still do this, get you moved in, get you to a great spot. So lots of options for people that never had options in the past. This is super cool. We're going to show you some of our process and some of the new instruments that have made this possible. All right, thanks guys. See ya. Bye.